Well, thank you all for coming this morning if you're on the West Coast, this afternoon if you're on the East Coast. My name is Grace Long. I'm the field coordinator with Population Connection Action Fund. I'm here with my colleagues, Rebecca Harrington, who is our Senior Director of Advocacy and Outreach, as well as Giovanna Solomon, our field assistant. I'm going to be going through some preliminary information for you guys today. But please note that while we are discussing, we have like a couple of panelists joining us. So while they're presenting on the Fight for Her, we are going to have a Q&A session at the end. So if you would please, if you come up with any questions before, during, after, please drop them in the Q&A section. You can find that at the bottom of your screen. We'll also be monitoring chat, but we would really prefer if you use the Q&A if that's all right. And then we're going to have Giovanna Solomon monitor our panel discussion using your Q&A questions a little bit later. So again, my name is Grace Long. I use she, they pronouns, and I am the field coordinator for Population Connection Action Fund. I'm a progressive organizer for over 7 years and a passionate advocate for over a decade. So in addition to our beautiful panelists, we also have one of our organizers, Matt, who is joining us from Phoenix, Arizona today. He is going to be sharing a little bit about his work on the ground, working directly with Fight for Her advocates, and as well as his upcoming events and his upcoming advocacy. So we're very excited to have him join us as well. Cool. So a little bit more about the team. Rebecca manages the grassroots field program to develop campaigns and messages that seek to defend reproductive freedom for everyone, everywhere. And Giovanna has 8 years of experience in issue-based and political organizing and joined our team after first getting involved with Capitol Hill Days, which some of you may be familiar with. But first, I'd like to ask you a question. How many of y'all are familiar with Population Connection Action Funds? Cool. So we're a little bit mixed. Which is totally understandable. We are the sister organization, technically. So basically, we are the political and advocacy sister organization to Population Connection. We share the same mission, which is reproductive rights for all, and supporting population stabilization through reproductive healthcare access. Specifically, through the Fight for Her campaign, we engage people across the country to take action against the global gag rule and to put pressure on members of Congress to support the bill to permanently repeal it, called the Global Health Empowerment and Rights Act, the HER, Global HER Act. We are also urging Congress to repeal the Helms Amendment, as well as demanding increased funding for international family planning. At the moment, our activities are getting petition signatures in support of the Global HER Act, but with the greater mission to activate reproductive healthcare advocates to also fight for global access as well as domestic access. So that is a very brief overview. We are going to go into the specifics a little later on, but I wanted to hand it over to Rebecca to start us off.
Thanks, Grace. I think actually I'm gonna give it to Matt so that he can get into the good stuff about what's happening on the ground, and then I'll chat about what's coming up down the road for us after that.
Sure. Thanks, Rebecca. So I've been organizing here in Arizona for Population Connection Action since July. That's when I started. I was organizing just in the community. So I'd go out to farmers markets, community events, things like that, other organizational events, Planned Parenthood events, and talk to folks there and ask them if they knew about the global gag rule. A lot of folks do not know what the global gag rule is. And so it was very nice to be able to educate them on what's going on around the world globally as far as reproductive rights. I could probably count maybe on my hand how many people actually knew what the global gag rule was before I talked to them. So I think that the educational aspect of the need for Population Connection to be here and educate the folks here in Phoenix is very high. I also went to, as school started, colleges started, I went to ASU, I went to some of the community colleges around town and talked to the students and folks there, and it was kind of the same thing. There is an abortion initiative on the ballot here in Arizona, and so a lot of folks kind of confuse that when I would talk to them. And so for me to just kind of clarify, like, this is a global sort of initiative for comprehensive reproductive health care. It was just very important to emphasize that this was a global thing and not just a state thing. And then we had to finish up our organizing. We had a summit. I hosted a summit in September, which turned out really well. We partnered with Planned Parenthood as well as Arizona Student Association. We had a turnout of about 33 people. That was mostly organic, which was really nice. Um, the demographic was very surprising as far as who showed up. We definitely expected a lot of college kids, but we got a range from high schoolers all the way up to retirees. So it was really great to really have a very broad community of folks come out and learn about the global gag rule and how harmful it is. Let's see, we had as well as at the summit, we had a couple workshops. One of them was an abortion doula workshop that went very well. Folks were very interested in that. And then personally, so my grandmother was a OBGYN nurse for about 40 years. And about 15 years ago, she went over to Africa for a safe birthing project to teach the women there safe birthing practices and things like that. So I was able to reach out to some folks that she met over there in Africa, and I was able to sit down and have an interview with them and what their safe birthing project is like and what they want to accomplish there. They are in a very rural part of Uganda, about 5 hours away from any major city. So they want to establish a medical facility there as well as get an ambulance and all kinds of stuff so they can provide really high quality, comprehensive healthcare in rural Uganda. I also just want to mention my fantastic fellows. I could not have done it without them. They were amazing. Parker Lewis and Ayana Daniel were definitely instrumental in helping me put together this summit as well as canvas and get lots of pledges. So yeah, it's going great here in Phoenix, and we're definitely excited for the canvas that's coming up. We're about to launch on Friday, tomorrow.
Thank you so much, Matt. I had the absolute pleasure of attending Matt's summit. Very much enjoyed it, especially hearing more from the folks working in Uganda. As many of you know, we do have quite a few people that we work with in East Africa, and it's always incredible to hear more about the work going on in that region, which is so important, especially the education portion and the access to reproductive health care. Rebecca, if you want to go and talk a little bit more about our canvassing that's going to be coming up in the next month.
Yeah, I would love to. I just wanted to ask Matt, just because I'm sure folks on the call are interested, if I can put you on the spot a little bit, would you mind just chatting a little bit about sort of what the political climate is in Arizona right now, particularly around reproductive health and rights and kind of what's going on there, maybe anything that's going on with the ballot initiative there, just so folks have like a little bit of a sense of what's going on in that place in particular?
Yeah, definitely. So right now we have Prop 139 on the ballot. We're definitely amped up about this. There's lots going on, lots of organizing around this ballot initiative. Um, and so it's definitely very, very high energy as far as the political climate. People are wanting to get into the political field, advocate for folks, canvas, do all sorts of things that they can do to really propel the movement further.
Thank you for sharing. Yeah, we've just had a lot of great on the ground work happening in Arizona. We're also working in Tucson, in Las Vegas, in Columbus, Ohio, across the state of New Hampshire. It's a small state, so we kind of cover the whole thing, as well as in the Lehigh Valley of Pennsylvania, all of which are key historically battleground states with, competitive congressional races and or Senate races. So, this first part of the fight for her this year has been really focused on the organizing piece, sort of educating people about the global gag rule. As Matt said, not a ton of people know about it. So educating them about that, really advocating and getting other people invested in advocating for a permanent end to the global gag rule through the Global HER Act, educating people on the importance of ending the Helms Amendment, and of really investing really robustly US dollars in international family planning and reproductive health care for programs that help people around the world. So we feel like we've laid a really nice foundation in each of these locations, all of which we've also, I'll note, worked and organized in before. So this isn't like we're dropping in to these places in March of this year and then leaving on November 6th, the day after the election. We've worked hard in all of these locations over the last decade in various capacities, either through the Fight for Her campaign or through other organizing efforts we've done. So we've really been working to build strong bases of support in each of these places for, reproductive health care and rights and family planning for people around the world, as well as statewide and locally and here in the United States. So as Matt mentioned, we are getting ready, kind of doing the final details to launch voter education canvases in all of these 6 locations. So for the next, gosh, I know every day we're like 40 days till the election, 30 days, but however many days it is right now, the next several weeks until the election, we'll be running nonpartisan voter education canvases, which means we'll be targeting a certain universe of voters, a certain group of voters. We're going to be talking to young people, talking to them about the importance of voting, encouraging them to vote, and then we'll actually be building vote plans with them. So I should say we'll be doing this all through a door knocking program. It's called the Canvas program, and we'll be door knocking on. The goal is to knock on just under 140,000 doors across all of these locations, and to speak with about 30,000 voters. So, we'll be knocking on the door. We have Canvas directors like Matt, who are running the Canvas offices in each location. We also have deputy directors who've been hired to support them. And then this is a paid Canvas operation. So we'll be hiring paid canvassers, a bunch of paid canvassers in all of these locations. And then there'll also be volunteer opportunities. So folks who have gotten interested in these issues and have been working with us throughout the summer and over the past few months since we restarted this campaign, will have an opportunity to knock on doors and talk to folks as well. So we'll be having sort of a nonpartisan general message of, are you planning to vote? It's an important election. Engaging in this way is a really important step you can take. And then we'll be asking them a series of questions to actually help them build a plan. So we'll be asking them if they know where their polling location is, if they plan to vote early in person, or if they plan to vote on election day, or if they plan to mail in a ballot. And then we'll ask them if they know if they're going to go in person, if they know where the location is. And then we'll ask them, if you know how you're going to get there. And research shows that when you help people, first of all, like the in-person interaction significantly raises the rates of people voting. And that if you also build a plan with people, I think the statistic is like people are 3 times more likely to vote, because it's sort of like when you make a plan for anything in your life, if you kind of have a concrete list of steps, you're going to be more inclined to follow through with it because it's not sort of an amorphous thing. It's something very specific that you're going to do it on this day, and this is how you're going to do it. So we'll be doing that. We'll be doing that until about 5 days before. Well, in some places we'll be doing it straight through election day. And then in a couple of other places, details are still being finalized for this. So we'll be sure to share them once we have them. But we'll be switching to partisan get out the vote efforts in a couple of places, which means that rather than having this more general message of like, are you planning to vote? It's very important. We'll be specifically asking and urging people to vote for candidates in the districts where we'll be canvassing. And these will be candidates that we've endorsed and that we're supporting in this election. So we'll switch to that for the final 4 to 5 days before the election in a couple of locations. And we think that this is going to be a really effective way to connect with people. Obviously, there's been a lot of coverage about how, young people are, a really important demographic and a really important part of the electorate that needs to be reached out to. I think they're getting a lot of outreach, which is really good. But we thought it would be really useful if we specifically went and talked to people in all of these places where we've already been building up support for some time. What else can I tell you? Yeah, I think I mentioned this already, but I think the groundwork we've laid over the past few months is going to be really helpful as definitely for the people who are working and doing the canvassing, because they are already sort of familiar with the issues and the mission. And even though they're not going to be getting into the global gag rule specifically at the door, they have a really strong investment in doing this work. And it's meaningful to them. And that goes for our organizers who are now our canvas directors and our deputy directors, as well as all the people who are going to be, paying to do this work as well. So I think the kind of arc from starting off and organizing and doing this education and, working towards summits and having people come to summits that transitions into canvassing work is going to be really impactful. And our goal is, of course, that it results in a bunch of people who, support family planning, support reproductive health and rights, will turn out to the polls to vote for people who are going to be champions of these issues and who are not going to be people who throw up barriers. I don't want to take up too much time talking about kind of the nitty gritty, and I want to make sure we have a lot of time for questions, but I was wondering if we could just share a few more in-person sort of anecdotes from the field, because I think people like to hear about that. Grace, would you mind sharing some of what you observed and what you found meaningful, or any good interactions you had in your travels over the last couple of months to the various Fight for Her locations?
Yeah, of course. So as I mentioned before, I had the absolute pleasure of being at Matt's Summit in Phoenix. It was about 115 degrees, but people were very happy to be there, and hopefully not just because the AC was on. We had a really great turnout. I got to meet a lot of people. Again, like Matt mentioned, there is a wide variety of age groups that are interested in these issues. We had everyone from retirees to mothers who were there while their kids were at school activities, to some like freshman college girls that I had the absolute pleasure of speaking with. They were specifically talking about how in their private college that they were attending, there was a lot of anti-abortion sentiment on Canvas and a lot of anti-abortion activists. So they were very grateful for the opportunity to kind of come into this welcoming environment to talk about the issues that they're so passionate about, even though they can't talk about them necessarily with their classmates or their families, as well as the opportunity to go beyond their campus and enact real change. They were very excited about our canvassing opportunities. I let them know that they can reach out to us whenever, and they were also very grateful to have somebody on the ground that they could contact. I also went to New Hampshire, which was a little bit cooler, which was nice. That was hosted by yet another one of our organizers who is based in Manchester. She's doing a lot of incredible work there, and again is now like transitioning over to canvassing. She also ran a summit that included keynote speakers and trainings. We also had like a lot of great turnout there. I think one of the great things about the summits is y'all partnered with a lot of organizations that are focused on the local and the national. So reproductive rights, both in their states, in many cases in their districts when it comes to issues like sex ed in schools, as well as across the United States. But however, again, like there is that information gap where they don't realize how much influence the United States has over reproductive healthcare access around the world. So like having those connections, being able to bring people in, knowing like, hey, you know, for example, Matt had some folks from Planned Parenthood Arizona who were both panelists and ran one of the trainings. People recognize Planned Parenthood, and once they come to a co-sponsored event, they can then learn about the many ways the United States affects, again, global reproductive health and rights. And I think that's a really like incredible benefit to, again, having folks on the ground to answer those questions, to go into the details with people and to spark those conversations. And I thought that there was a lot of, for lack of a better term, good vibes from the summits. And we had a lot of signups for the petitions, which again is leading to identifying those dedicated advocates that are going to be in these key districts for the long haul. And so I'm very, very happy that we are building those bases, and they are strong and they are very passionate. And I have a good feeling that we're going to be working with these folks for years to come. Rebecca, you also had some on the ground experiences. I wonder if you also want to share some of your takeaways.
Yeah, it was interesting. I visited both Tucson and the Lehigh Valley of Pennsylvania, which is an area that includes Allentown, Bethlehem, and Easton. And in Tucson, it was really interesting. We had a bunch of different representatives from a bunch of different community organizations there. A lot of Latino organizations, which makes sense given the demographic of the state and the area. Working on a bunch of interconnected issues, including reproductive health and rights and justice, but also working on water issues and water rights and water safety, working on environmental justice issues, working on voter rights issues. And it was really nice to see all of those issues be discussed and to see people making really good connections between them, both the people who were speaking and the experts there, but also the people in the audience who, were young, kind of ranged in age, and some were students and some were not. Some were working on these issues professionally. Our event there was co-sponsored by a Planned Parenthood Generation Action Group at the University of Arizona campus. That Planned Parenthood Generation Action is like the student Planned Parenthood group. And they kind of came out in full force, and they were all wearing pink, and they kind of just like were so on brand, and had a lot of really interesting things to say about the work they're doing on campus and how they're working with young people. So that was really great. We also, and we're going to plan to share these at some point so people can see them more widely, but had some really great talks from a woman named Cassandra Becerra, who works for Representative Raul Grijalva. Representative Grijalva represents parts of Tucson and the Tucson suburbs. So she talked about their commitment to reproductive health and rights and family planning. Representative Grijalva is a co-sponsor of the Global Her Act and a great supporter of the issues that we work on. So it was really great to see someone from their office join us, and for them to see, and to think that what we're doing is important and wanting to be part of it. And then actually Representative Grijalva's daughter, Adelita, also joined us. She's one of the Pima County is the county that Tucson is part of. And she's one of the county supervisors. So she also came and spoke about her work and about why, issues of reproductive health and rights are so important to her as a mother and as a woman, and as someone who's working in the community with, many, many people, all of whom deserve, the right to reproductive autonomy. So that really stood out to me from my time there. And then in the Lehigh Valley, I was really excited that we had a group of about 8 high school students from one of the local high schools who've been recruited by one of our summer fellows. We ran a fellowship program this summer to sort of give people an 8-week immersion in working on a campaign, learning about the issues. And this fellow of ours, Presley, just recruited all of these students from the high school that she had attended. And I always love to see really engaged high school students, because I feel like if they're already engaged at that age and they're already sort of plugged into political and social causes, that, as they get older and have more opportunities on a college campus, if they do that, or as they go to work, they'll just have more opportunities to become engaged and kind of bring those skills with them. So that was really, really great to hear. And I really enjoyed that as well. And just in general, just obviously we're, we've said this for the last several elections, like this is the most important election of our lifetime, and it is, and there's so much at stake. But I think something that all of us have really appreciated is the ability to see that people are not laying down and taking all of these attacks on reproductive health and rights, whether they're happening here in the States, in local, even more local levels, or around the world lightly. And they're really fired up and ready to take action, obviously to get out and vote, but also to educate their communities, to show up at events, to, table at a farmer's market, and to educate people about policies like the global gag rule, policies like the Helms Amendment, so that people understand that we're not just doing horrible things here to reproductive health and rights, but that we're really also trying to export that to other countries and to other places around the world. I want to just pause and poke in the Q&A. And I did realize I should back up. We keep referencing the global gag rule, but I don't want to assume that everyone on the call is familiar with that policy. So for anyone who isn't, the global gag rule is a terrible policy. It's not currently in effect because President Biden lifted it early on in his term. But when in effect, it's a policy that says that any foreign non-governmental organization that wants to receive U.S. Foreign aid, family planning assistance dollars, cannot do so if they so much as mention the word abortion. So if they perform abortions, do referrals or counseling around abortions, or do any sort of political advocacy around liberalizing their own country's abortion laws, they can't receive US dollars. Even if they do any or all of those things with their own private non-US dollars. If they want to receive US funding, they can't even talk about abortion. So obviously this is terrible on many levels. It's gagging speech, it's preventing providers from providing the most comprehensive level of care. Anyone who knows anything about reproductive health care knows that you can't talk accurately and fully about reproductive health care if you don't talk about abortion and you don't talk about safe abortion and the impact of unsafe abortion. So it's a terrible policy. And that's why we've centered our campaign around ending that policy, because it's just caused, death and injury and unnecessary suffering for people around the world when it's been in place. And it's always been issued in the form of an executive action by the president. So it's ping-ponged back and forth depending on whether a Democrat or a Republican is in the White House since 1984 when it was first imposed. So the Global HER Act, the piece of legislation that Matt mentioned, would serve as a permanent legislative repeal of the policy. So it would permanently end the policy, and it would take that power, that unilateral power, away from the president to just impose it, reimpose it based upon political whim. So just wanted to make sure to talk about that a little bit for anyone for whom that's new information for. Matt or Grace, did you want to share anything else before, or Ivana, before we move on to questions?
Yeah, I just want to mention that earlier in the summer we had a sort of tour with Melvine, who is one of the consultants that we work closely with. And she really helped connect the why of what we're doing for people who attended. A lot of students really were able, like afterwards they came and they spoke with her and expressed all of this gratitude for really being able to understand the importance from the perspective of someone who is directly affected by the global gag rule. And I think the more that we are able to expose activists and volunteers and students to what's happening on the ground, the more that we're able to see them get involved and really become galvanized to make sure that the Global HER Act is passed and becomes a reality. And that's a big part of what our organizers are doing, is helping to connect that sort of the gap between our reality in the United States and how everything that we do here, it has an impact and a ripple effect out in the rest of the world. So yeah, that was a big part of the summits as well.
Thanks, Ivana.
Yeah, it looks like, Rebecca, you answered the question in the Q&A. We did have some pre-submitted questions. So if no one else has anything else they'd like to share, we can jump into some of the questions.
There is one
Does that work for
Ivana that I see. Someone was asking, where can people see which candidates Population Connection Action Fund supports? So we can drop a link in the chat, so you can go to our page of endorsed candidates, and you can see all the House and Senate candidates that we've endorsed, along with Kamala Harris and Tim Walz. Sorry, Ivana, go ahead.
Great. Nope, that's fine. So we have a question here that says, do you have any insight into what would happen if both referendums passed in Nebraska?
So I saw this question and I immediately got to work reaching out to my friends doing work on this in that part of the country. I always kind of forget what that is. Great Plains, Midwest. I'm waiting to hear back from a colleague of a good friend who used to work as the legal director at the ACLU of Kansas, who reached out to her friend who's at the ACLU of Nebraska. So when I hopefully get some more info, with some sort of on the ground info from that person, I will share it in the follow-up. But it's a kind of an unusual thing that's happening for people who don't know. So within the last week, the Nebraska Supreme Court ruled that two competing abortion measures can be on the ballot for the election in Nebraska. So one is a pro-abortion rights initiative that would enshrine the right to abortion, a constitutional amendment that would enshrine the right to abortion through the point of viability. The other is a constitutional amendment that would ban abortion at 14 weeks. So they're both, competing, and they're both on the ballot. And the way it's going to work is whichever ballot measure gets more votes will if they both pass, and I'm not sure, I just don't know the threshold for passage. I would have to look that up. But if both pass, whichever measure gets more votes is the measure that will be enacted. So, of course it's complicated because as these, as ballot initiatives often are, they're, one is like, we can look it up and drop it, but I think the anti-abortion one is, measure 434, and the pro-abortion one is 439. But in order to really make your vote count, if you're in favor of the pro-abortion rights measure, you have to cast your vote yes in favor of that. But you also have to cast your vote no against the anti-abortion measure, which, even for seasoned voters seems like a challenging thing to keep track of and keep in your mind, as you're voting. And for people who are perhaps less familiar with the process and are less familiar with things like ballot initiatives, could be confusing. So I don't have anything to share. If there's any Nebraskans on the call or anyone else has any kind of on the ground intel that they'd want to share, I'd welcome you dropping it in the chat or sharing it. But I will share anything I get from on the ground in Nebraska. But definitely something to keep an eye on, a pretty unusual circumstance in which opposing measures have both been allowed to be on the ballot.
Yeah, thank you. It's very confusing, and it takes a lot of conversation over and over and over again for people to really understand how to make sure that we're voting to protect comprehensive reproductive health care. We have another question. Will Capitol Hill Days return?
Oh, very good question. The short answer is we don't know. Capitol Days was always a great event. We love doing it. We haven't unfortunately been able to do it in person since the pandemic, for safety reasons and other reasons. But it was always a great opportunity to connect with donors and activists and to teach people some organizing skills and kind of flood Capitol Hill with visits from people who care about these issues. We're not sure yet if it will return in 2025 in the same form that we had always done it for 20 plus years before the pandemic. But that doesn't mean we won't be doing anything. We have just been talking about kind of reformulating it and maybe doing it, a little bit differently, having a different format, or maybe rather than doing one signature event, doing a number of different events throughout the year, maybe in different locations rather than in DC. So that's kind of a not real answer because it's like a no, maybe yes, sort of. But as we have more details on whether that event will return or other events, we'll be sure to share them with you all.
We will be anxiously anticipating those details. I personally think that Capitol Hill Days is such an impactful event. That's how I ended up here, and I think it really brings a lot of people into the movement. Our next question is, how were the key locations for the campaign selected?
So all of the locations are historically battleground, historically or more recently battleground or swing states. So places that have not, been 100% Democratic or Republican, but have kind of gone back and forth. They all also have either competitive House races this year or Senate races. Is one component. That's kind of the political component. There are also places that I mentioned earlier we've worked in for a long time. So we've built relationships with campuses and with activists and with community organizations. And we know that these are good places to organize where there are people who are eager for this type of engagement. And want to learn more and want to know how they can be active on these issues. So that's another reason.
Great. And then we've got a good one here. Where can I sign up to get involved with the organizing opportunities with Population Connection Action Fund?
Grace, you want to take that one?
Yeah, of course. So we do have, as we mentioned before, running petitions for each of our key locations, but we also have a petition for everybody to sign. So if you're not currently living in one of the places where we're organizing, you can still have hear from us about opportunities that are more national focused. All you have to do is go to the Population Connection Action Fund website. You can find all of our location signups and the national sign up under the Fight for Her page. And I will be dropping the link to that in the chat in just a few.
Thanks, Grace. So you all use that link and we will hook you up with opportunities to do the work. Another question we have is how can we build stronger coalitions among community leaders, activists, and policymakers to create a more unified movement for reproductive rights?
I've been talking a lot, so does someone else want to take that one? Happy to jump in, but want to give space for other people to speak as well.
Yeah, so I think one of the things that we've experienced when we're organizing on the ground is there is a lot of understanding about the interconnectedness of reproductive rights with other social justice movements, such as the trans rights movement under the umbrella of bodily autonomy, obviously the feminist movement, as well as racial justice. So we do have a good understanding with other organizations about the dangers that the attacks on reproductive rights pose, as well as the damage that they've already done. So we've really enjoyed working in coalitions with our partners because of that understanding. We are also trying to broaden the understanding of the folks that we're working with directly, who again are like not necessarily aware of the interconnectedness of these issues. Especially since, of course, one of our main goals is to explore the connections between reproductive health and rights and the current environmental crisis that is global climate change. But I think a lot of people that are working that are like dedicated advocates, they are aware of these connections and they bring them a lot to their work. So there is like a lot of understanding there as far as building coalitions go. Again, we are more presenting in the same way that we're presenting to the individuals that we're working with. We're talking more about the global impacts of US foreign aid policy, which is maybe not something that they are as aware of.
Yeah, and I think just to add to what Grace is saying, as Giovanna alluded to earlier, we're also always really trying to talk less about sort of the ins and outs of policy, although we do that as well. And we're trying to really ground the work that we do in real lives and real stories to help people understand, you know, why this matters for real lives. And this isn't just, you know, about sort of statistics about things that are happening in a far off place. I think that's been easier in the last 2 years since, you know, Roe v. Wade fell with the Dobbs decision in June of 2022, because all of a sudden, and not that these things weren't happening before, but all of a sudden there was a cascade of abortion bans and bans on contraception being proposed, and now bans on IVF. So people in all the places where we're working and around the country have been able to see much more up close what happens when these rights are started, you know, are taken away. So I think that's even though it's awful that that happened, it's really helped sort of fuel movement from people who perhaps were aware about these issues before, but weren't as engaged or involved.
Yeah, absolutely. And revisiting the previous question about how people can get involved, if you could speak a little bit more about specifics. This question is, in what ways can new advocates or supporters contribute to the movement?
Yeah, that's a great question. A couple of things. Definitely start by signing the Fight for Her petition. That's in the chat box. That will get you on our Fight for Her list. So you'll get information about events we're doing on the ground, about virtual events like this, and you'll also see volunteer opportunities to door knock or phone bank or text bank or things like that. So that's a really good place to start. We will, in addition to paid canvassers for the canvases we'll be running in our 6 target Fight for Her locations, we will be inviting volunteers to join us as well. So if you're someone who likes to chat with people and you like to knock on doors, reach out to one of us, and we can connect you with the organizer in the, whichever location you're in. There are a lot of other ways to get involved too. If you, like to, it's shown that like talking with people you already know in your family or in your social circle about voting and politics and social issues is sort of the best way to influence them. So you could hold something, we call it, a kitchen table conversation, but it's just like having people over to your living room and having snacks and drinks and talking to them about, teaching them about what the global gag rule is, or teaching them about what's happening in your community in regards to reproductive rights or the environment or any issue that you care about. So that's a good way to sort of start and kind of start with your own built-in network. You know, there's keeping up with what's happening in the news and responding with letters to the editor is another relatively low bar, easy way to get involved. Letters to the editor are very short. If Marianne's on, she can she can drop exact word count in the chat, but I think like 150 to 200 words. So if you see something that comes across in your local news or in national news about reproductive health and rights or an abortion ban or about population or about something related, you can submit a letter, and they publish them every day, in across publications. So that's another thing you could do. Joining events like this and recruiting other people to join them as well is another thing you could do. So just sharing the invite for an event like today's with 3 to 5 friends. And then the other thing I'd say, as we're upcoming to the election, kind of recruiting 3 people to go to the polls with you on election day, or to, all get together and fill out your ballots together, even if you don't want to share who you're voting for. I think little things that you can do, especially with your built-in communities that all of us already have, is a great way to start. I don't know, Grace or Yvonne, if you want to jump in with anything else.
Yeah, absolutely. So another one of the big things is just doing the simplest thing, which is to forward the link that we dropped in the chat to the Fight for Her main page. Just telling your friends like, hey, there's this campaign going on. If you're interested, please just sign up through the petition. That gets them on our mailing list, which means we have more opportunities for them to connect with us directly and volunteer with us. But also, again, like if all they can do is just put their name in that petition, that's already an amazing thing. And it's already like one step forward for our goal. Another thing that y'all can do, and I just like want to reiterate this point, is if you live near any of these areas, but you don't live, for example, in Phoenix, but you would be willing to drive there maybe for a weekend, the reason we've made these petitions location specific is just so that we can make sure that we get your information to the organizer that's closest to you. So you don't have to be in Phoenix to sign up to be a volunteer in Phoenix, as long as you're willing to take the drive. So if any of you are in the general vicinity, or anyone in the general vicinity that might be willing to, go down for like 4 hours on a Saturday and knock on some doors, we would appreciate it. And that way you'll be kept up to date on Phoenix specific opportunities as well.
Oh yeah, donating to the Action Fund if you're so inclined is also another great move. Giovanna, were there some more questions?
Yeah, there's another question here in the Q&A section. Is the Fight for Her or the organizers in red states also highlighting the importance of contraceptive access as a deterrent for abortion, especially in the anti-choice heavy areas. It seems like red states are also against contraception, access to contraception.
Yeah, so I will say the good thing about working for reproductive rights and contraceptive rights is how popular these issues are, even among Republican voters. However, unfortunately, that is not reflected in our elected officials who are Republicans. Um, so that is one of the things that we're trying to activate people on, even if they're not necessarily with us on all of our issues. Statistically, they are very likely to be against the dissolution of Roe versus Wade, for example, and many, many more are against any bans on access to contraception. I would hesitate to present contraceptive rights as a deterrent to abortion to a certain extent, just because we do want to make it clear that abortion should be accessible under any circumstances. But you are right in that it is a hypocrisy that they are not supporting access to healthcare that would lower the number of abortions. However, unfortunately, pointing out hypocrisy is just not enough to persuade these people to actually stand by what they say that they stand by and stand by what their constituents believe. So it is, while it is again important to say that, you know, they're contradicting themselves, really the important thing to highlight is they want complete control over our health and our bodies. And that is what things like Project 2025, no matter how much a presidential candidate says that he's not supportive of the anti-contraceptive and anti-abortion measures in Project 2025, these are his most prominent political backers. And we know his track record. So we know that he is going to follow along with whatever these folks say. And the same is true for many other Republican candidates, no matter whether they're local, national, state level. So we are taking the ban on access to contraceptives seriously. And we are also highlighting, again, like many of these clinics that are affected by the global gag rule because they refuse to not tell their patients like the full services that are available to them. They refuse to not say the word abortion. That also means that many of their communities stop having access to like contraceptives and birth control because these are the people that are handing out condoms, that are, you know, handing out birth control pills. And that is one of the things that is lost when the global gag rule is put in place. And it also disrupts supply chains and partnerships between clinics and organizations that once again, they don't have access to not only the right to perform abortions, but they don't have access to the basic tools that they need to make sure their community has basic bodily autonomy. So we definitely do want to highlight that as part of the larger goal of the Republican Party, because that is definitely a huge aspect of the impacts of the global gag rule.
I think we have time for one last question. And that is, what role does public opinion play in shaping reproductive rights policies? And how can we mobilize communities to influence positive legislative change?
I think, oh,
Sorry.
yeah, I think we've seen, for a long time, the public has largely been supportive of birth control, and of abortion, to some degree. And I think in the last couple of years since Roe fell and since abortion bans have been thrown up all over the place, and there's complete abortion bans in 14 states in the US now. That's really activated people, and that's really made people sort of like wake up and say like, oh, this is happening here. It's not happening like next door in the next town or in the next state or in the next country. It's happening right here. So I think, and I think as the 2022 midterms election showed, election showed, you know, abortion and reproductive rights is a really motivating issue, and really worked out positively for Democrats. And it seems to be going into this election as well. It seems to be, you know, the number one issue that people are focused on, particularly women, particularly young people. So I think, you know, continuing to have opportunities for people to be educated about what's going on and giving people opportunities to take action, is really important. I think it's already proven to be an issue that is really mobilizing and really effective at getting people kind of out the door and on the ground. Grace, you had something to say?
Yeah, I definitely do. Again, once again, want to highlight the anti-abortion movement is a very loud, very vocal minority. They do not represent the majority of Americans. And as we are seeing now, once again, like it's a mobilizing issue. People believe in access to abortion. They especially believe in access to contraception, and they are willing to go to the polls and prove that. So we are very optimistic about how this election is going to shake up, though, of course, we are doing everything in our power to make sure that pro-abortion champions are elected into office. And we're not going to let, again, the very vocal minority win. And we know that the American people don't want that either.
Awesome. Thank you all. That concludes our Q&A section.
And thank you all for joining. It was really great to have a chance to share some of our work and our experiences. And we hope those of you who are already involved stay involved with us through the election and beyond. And for other folks, would love to have you. So sign up, reach out to us, have chats with us. We'll plug you in wherever we can. And thanks for joining today.
Thank you, everybody.